Here we go, gang. All right, here we go. All right, good afternoon.
Good afternoon.
For those of you who I don't know, here and in the rest of the world, Paul Fortier, Vice President of 1199. And really, the most important thing I want to say right now is the actions we're doing today, we've been forced to do. We don't take this lightly. This is not a game. This is not about anger. This is about trying to provide services for the individuals that we've been serving for years, and we have not been able to do it. We have been talking with management for over a year now, and they continue to drag their feet on giving us what we need to provide the proper services. So we're here today. I hope you like my big print, my glasses. We're here today to educate the people of Connecticut of the crisis transpiring at Whiting Forensic and CVH. We have been in discussions with DMHAS management for over a year regarding staffing levels and the fact that we cannot provide quality care. Another result of the staffing crisis is good healthcare employees leaving CVH and Whiting for less stressful environments elsewhere. The ultimate losers in the crisis are the patients here that we serve. We are here to demand that the state give us the ability to provide the proper services. And that's the gist of what we have. And now what we're going to now have is 4 or 5 of you who are going to testify and give the specifics of what's going on here. Avery?
Yep. Thank you. Maybe my co-speakers want to join me here. Hi, everybody. I'm Susan McKinley. I'm a licensed clinical social worker. I work at the Whiting Maximum Security Building. I'm one of the admission units where we do the court-ordered evaluations. I've been working for the state of Connecticut for the state of Connecticut for a very long time, but working in the Connecticut mental health system for more than 30 years, and I've been a member of 1199 for that time. As Paul indicated, our message today is pretty simple, and we've done this over and over and over again over the course of the years that we've worked together. Proper staffing and effective safety interventions are essential to good care at Whiting. And in truth, our patients really deserve nothing less. Whiting is a safety net for the state's mental health system, and we care for those who have been deemed too challenging or too dangerous or simply unmanageable by other entities. Our staff are knowledgeable, hardworking, and are dedicated to providing the best care possible, often under extremely difficult conditions. As Paul said, for more than a year we've been meeting with this new administration at Whiting in an effort to address real day-to-day issues regarding patient care and safety concerns. During the better part of the last 2 years, we've repeatedly reached out to the commissioner about these same issues, and our efforts have been largely ignored, unfortunately. What's worse is that our concerns have also been met with distinct roadblocks and condescension from management. Management has chosen to deal with problems in a punitive manner, issuing discipline rather than attempting to make corrective action. Management has also asked for our input, but our suggestions have often not been implemented. Management understaffs nursing and other disciplines, thereby limiting our ability to address all of our patients' needs. In short, we need a commissioner and an administration who support the work of Whiting employees, who believe in and trust the knowledge and expertise of the direct care staff, and who can make it possible to do the work that we are trained to do in the safest possible way for the patients, the employees, and for the general public. Hopefully the commissioner will hear us and take up more productive, useful talks that will make positive change for all of us. Thank you.
Thank you.
Well said.
Hi, good afternoon. My name is David Latronica. I've worked on the nursing units in Whiting Max 15 years. I'm here because we've tried to address our concerns, as Susan mentioned, with Whiting administration multiple times. New administration recently changed the nursing staffing policies in the building. For as long as I worked there, the units ran with 2 nurses on first and second shift. That changed, and we now have units running short of nurses. We take care of the most acute patients in Connecticut. We cannot provide necessary care to our patients if we don't have the staff. 2 nurses on each unit and 3 nurses on unit 4 means that we have enough nurses to pass meds and to be available for patient needs. We need enough staff on the units to cover patient trips and appointments. Oftentimes we have to absorb that from the complement of the unit, and it leaves the units dangerously short. I'm concerned about the safety of the patients, my co-workers, and especially the community. Recently, the administration changed the policy for transporting patients for appointments off grounds, doctor's appointments and such, where offices are nearby. My job is to ensure that my patients are being rehabilitated when they receive the care and attention they need. I'm not considered to act as a police officer while out in the community, and I don't have that authority. And I feel that if our patients are safe enough to go off grounds for appointments without a police escort, they should not be in the care of Whiting or under my care. We're asking the Commissioner and the administration to restore nursing staffing levels, provide adequate staffing to accommodate all of our duties on our shifts, and to ensure that patients are escorted into the community with 2 line staff and an agency police officer. Thank you.
Thank you.
Hey.
Good afternoon. My name is Tanya Long, and I work in the Addiction
louder,
Services
please.
Department here at CVH. I've been working here for the last 14 years. Patients come here to CVH and trust us to not only provide a safe detox and rehabilitation, but also the stability, structure, and guidance to a drug and alcohol-free lifestyle where they can. And at the same time, receive the emotional support and understanding that their addiction has completely taken over their life. When patients arrive on our floors, they truly hit their personal rock bottom and are at the most vulnerable time of their life. It is our responsibility to assist them in their recovery as they strive for a better, clean, and sober life. In the last 3 years, the staffing has gotten so bad that patient care has truly suffered in the midst of an opioid crisis here in the state of Connecticut. We're so short-staffed that I often myself have to tell the patients that I cannot help them because I have so many other duties, the duties of 2 or 3 staff members. I can't even get them snacks or coffee. It's the hardest when patients are going through something emotionally and they just are in need of time to talk to us, and I'm not there. We're too busy. We don't have the time to spend with them and give them the emotional support that they need. Many of us have been forced to work 16 to 20 hours straight, multiple times a week, and this also decreases the quality of care and creates an unsafe working environment. When we are inadequate staff, we fall short of our own mission statement and our goals for the people and the community we claim to serve. Most of our patients who come here have been neglected and traumatized on the outside. They come to us, and we're so short-staffed that we are unable to give them the care they are seeking at that moment. CVH's vision statement says we promote recovery through collaborative, compassionate, and culturally competent treatment in a safe and caring environment. We are here asking the Commissioner of DMHAS to not only perform a staffing analysis, but increase the base staffing here at CVH, so that we, the nursing staff, may follow the policies set by the administration and perform our job duties, not only to give our patients the proper care they absolutely that they come here for, but the care that they absolutely deserve. The care that is promised in the vision statement of this very hospital. Thank you.
Good afternoon. My name is Martin Thomas Taylor. Louder. Yes. Good afternoon. My name is Marva Thomas Taylor. I work as a registered nurse at CVH. I've been working here since 2003. I've worked in the healthcare field for 39 years. I became a nurse because I wanted to help people. I love psychiatric nursing because supporting individuals experiencing mental health challenges enables them to function as a member of society. There's a problem here at CVH, which is that there is not enough staff to be able to provide adequate support to these individuals. Although we render safe care, we want to deliver the kind of personalized attention that instills hope and not despair. There's not enough time to complete our responsibilities on the unit as nurses and to sit and talk to the patients or to respond to their every needs. They want that one-on-one support and communication which they lack in their lives. That's what brought them here to the hospital. It's a 22 patient staffing on each unit. When I'm the only nurse on the unit, I have to do paperwork, emergency care, passing meds, supervise the direct care staff, and their delivery of care. I am ultimately responsible for the staff and for the patients. I'm in charge of everyone who walks on that unit for their safety, well-being, in addition to supervising the delivery of patient care. With all this, it's not enough time to talk to patients. The short staffing affects the delivery of care because each person is taking the work of 2 or 3 people, and the demand is enormous. The low staffing levels mean that new nurses come in, work the units for a few months, and become frustrated. We're not able to give the patients the attention they need. New nurses see the acuity of our patients and the lack of support we get from our regulatory body. Computerized based training instead of in-person training, the number of assaults and allegations that occur in the units, not having enough staff, this means retention is terrible. Nurses come, experience, they leave. We need better education, training from our regulatory bodies for how to support specific patient population, and we need more staff on the unit so we have enough time to give the patients attention they deserve. This is about our shared humanity, humanness, staff, and patients alike. We are here to support our patients in recovering from their mental health challenges. We need support from DMHAS administration to be able to succeed in our mission, and our mission is in helping individuals to receive treatment and services that assist them to better manage their illnesses, achieve personal goals, and develop the skills and support that lead to living the most constructive and satisfying lives possible. Thank you.
Are we doing Q&A?
Any questions?
Yes. Did they hire back the workers that were let go?
Did they hire back the workers?
Were they replaced? I don't mean hire back the individual. I mean replace the staff. It got depleted. Did they hire people to replace those that left?
I don't believe that they've been able to hire back and fill most of fill all the positions, and especially when you continue to have people leaving on a regular basis.
So some positions remain vacant from that period, plus
Well,
no retention, the retention issues.
The problem is retention.
Actually, we have some numbers though. Currently, last year we had 154 direct care staff in the Whiting Maximum Security Building. Today we have 115.
Okay.
That doesn't, that's not counting nurses, right? That's not counting RNs.
Does that include the numbers for judgment?
I don't believe so, no. So then there would be a separate indication of how that staffing has been depleted as well.
You mentioned escorts. What is the process for that now? For an escort for a patient appointment off grounds?
David.
As far as an escort is concerned, there's a risk assessment that's done by the doctors in the hospital for the patient to determine at what level they can be transported. We currently feel that if the patient needs to come out of Whiting Max at any appointment, there should be an agency police officer present. They've written it so that they can place that patient under a status that will allow them to be brought to a doctor's appointment by either 1 or 2 direct line care staff. And we have no authority outside of the building to do anything.
So the police officers don't go anymore for certain assessments?
Correct.
Okay. And that messes up your whole shift. You got 2 people out
Yes.
on
and
a
then
short
they-
staff already.
And then you have internal appointments as well. We escort for internal dental appointments, covering activity centers, things like that. And I believe, correct me if I'm wrong, that the agreement with the city was that it would be police officers escorting people. I'm unfamiliar with that.
I know that there had been there had been some discussions, but I don't know that it has really resulted in actual policies that have been drafted by the hospital and put into effect.
Can I get your name?
Paul Fortier, Fortier.
And what is your role?
vice president of the union.
Okay. And can anyone give me a specific examples of what kind of dangerous things are happening, especially at Whiting, that are putting the staff and patients in danger too?
So for several years, we have a behavioral management strategies program for when it becomes necessary to physically address behaviors of our patients. We attempt to follow the treatment plan. We certainly attempt to verbally de-escalate difficult situations, and then there's a physical management program. For more than 2 years, for almost the entire time that I've been at Whiting, we have been expressed concerns about how this physical management program does not in fact address real safety for the patient, real safety for employees, and we've continued to have the same discussions over and over and over again without any real change in the programming.
Thank you.
What's your name, ma'am?
Me?
Yeah.
I'm Susan
Conveying that
McKinley.
It's a systemic
MC,
issue,
capital K.
not just for
I
Whiting
am.
Forensic Hospital, but also for the CVH Hospital and the other units that we cover, other buildings, Bell
Licensed
Hospital,
clinical social worker?
as well as Woodward and Mare. We have the same issues. It's not just Whiting Forensic, it's hospital-wide. And again, getting back into safety, the concern is if you're forcing people, forcing them to work 18, 20 hours, day after day after day, you know, what kind of health aspect is that for the patients and the staff? You've got staff that are overworked, staff that have no home life, staff whose health is going to be affected, and how is that going to affect the way they interact with the patients? It's important for staff to be rested when they come to work, not overexhausted.
Can I get your name?
My name's Bromley German.
Bromley.
Yes.
And then German?
German, just like the national.
Okay, and then what's your role?
I'm a registered nurse in Dutch Road, second
Okay,
shift.
thank you.
All over the hospital on any given day, and it happened today, employees are asked to stay for overtime voluntarily, that they agree to stay for overtime. And when they can't, they can't. And sometimes it becomes necessary to mandate staff, which is disrupting their lives and exhausting to work an additional shift. Unfortunately, today we found out about a situation where an employee was agreeing to be able to stay so that other employees could go home, and instead they allowed the person who wanted to volunteer for a shift to leave and forced other employees to remain. That kind of staffing policy hospital-wide makes no sense to us at all, and it's not good for good patient care.
And based on our contract that I've been mandated, is a case of emergency. This is beyond emergency, and what is happening now too is that we're getting mandated, and if we pass, because in our contract we have a thing that said we could pass an exam. If it goes through the list and it comes back, we're getting directed order from the supervisor. Then if we walk and say we're not doing it, we're getting written up. So we are also tired, and on the other hand, the supervisor is telling us, I'm giving you a direct order, and if we say, okay, I can't stay because I already did 3 and I'm tired, now we're getting written up.
What happened that it went from 154 last year to 115? Was there a moment where you guys realized that this was happening, or did the administration say anything, or?
No,
Okay.
People are retiring and they're not hiring
Got
fast
it.
enough. So this is also, we have people who have retired, people who is out on comp, people who is out on vacation, people who is calling out sick because they're tired. So it's just a revolving door, and they're not up to par with everybody that has retired to fill the units then.
And keep in mind, those numbers reflect Whiting. No disrespect to you guys. That doesn't include Dutcher, which is also extremely short on staff, and Patel, and every other unit and every other building that works in CVH and Whiting Hospital. You know, this isn't something that's new that just surprised everybody. It's just that the job of administration for filling positions and making sure that the positions are being filled hasn't been done.
Well, the other big issue is, and we've spoken to it, but it didn't just come out in this answer. New people coming here, they're finding that it's a very difficult place to work, that there's a lot of strife, right? And a lot of people are coming here and they're saying, you know what, I didn't come here for this. And people are leaving regularly who are, we're expecting them to fill the slots, and it just is not happening.
And you have a petition, 700 people signed?
Over 700 people signed, yes.
And what happened? The petitioner wasn't available apparently to hear our concerns.
We were going to deliver to the petition to the commissioner last week at a meeting, and then she chose the day before to let us know she wasn't going to be coming to the meeting. But she said she would schedule something a month from now to meet with us, and obviously that was an issue, and then she figured out what she did was wrong, I guess, and she agreed to meet with us next Tuesday. But again, we've been meeting with her underlings, with the people that actually are the bean counters, and we need management from up above, right? Above them, to say, you know what, we really have to do the right thing. We really have to staff CVH and Whiting properly, because it's an accident waiting to happen.
Well, the accident already happened because several staff has gotten hurt, and I'm one of them. I was out for a whole year. So several staff has gotten hurt, and they're still not caring about that.
Do you guys have any numbers on injuries or assaults or anything? Thanks.
So, in Whiting, I believe the numbers of patient-to-staff assaults between January and April was above 50. At CVH, the number of patient-to-staff assaults was 134 in that 4-month period. And this we see as a direct reflection.
This year?
This year, January to April this year, yes. The number of patient-to-patient assaults at CVH, I believe, is over 130. I don't have the exact number. And in Whiting, I think it's around 40 of patient-to-patient assaults. So what we're saying is this chronic understaffing, the exhaustion of the workers who are currently in the building, and the lack of support and training from management and the administration is creating dangerous conditions for the patients and dangerous conditions for the members here.
We're also not, at CVH Hospital, we're not hazard duty. So unfortunately, the amount of assaults are much higher than they are at other hospitals. A lot of our veteran staff, as I said before, have took early retirement. Some of our other staff, the new staff that came aboard, left real early, especially our nurses. And it's really hard to try to, as a staff, to encourage people to stay. We need you. We want you here. And management's not helping. Just last weekend, there were 5 people disciplined, and they were overtired, and they were disciplined. They were removed from their shift, and now they're not available. So now our staff is down even more depleted. So I think the issue we need to look at is recruitment has to be the #1 priority. The second issue has to be fairness. Many of our membership are being questioned by management without being told their white garden rights. We have a right to organize a union. You have a right to have a union delegate there to make sure that your rights as a worker are being followed, and they're not doing that. People also not have FMLA, Federal Medical Leave Act, and they're told they cannot use it. When they're exhausted, they're tired, and they have medical issues. Myself, I am a diabetic. I was told I couldn't use my Federal Medical Leave Act. The next day, I went to the hospital. I had to get 2 bags of fluid plus insulin. I could have died. So I think the message needs to go out that we, the 94% that voted for Ned Lamont, the union that supported Ned Lamont, come back and support us, because we don't forget. You think our union is not strong? Look out here. We're strong.
Any other questions from the press? All right.
I wanted to say something about the new administration that we have. They've only been around for almost 2 years since this whole thing took place.
Talking about Whiting.
Talking about Whiting specifically, they claim to have these town hall meetings where they're asking for our suggestions, and they want this culture of mutual respect, but yet they don't actually have these meetings. There was a task force meeting that was done the other day. It was aired on public access TV, and Hal actually said that he had several of these meetings and on third shift, and that's not true at all. He has had one meeting, and at that meeting it was just a bunch of rolling around the bushes and just, you know, no direct actual answers. That's what we've been putting up. And that is a problem by itself. But then you have all these inconsistencies with people being accused of different things and how those people are being treated once those accusations come out. They're not following our union contract when it comes to any kind of disciplinary actions. They're not doing that.
Okay, you all set?